One Community Health is a federally qualified health center, which means that we do get some grant funding from the federal government, primarily to serve underserved populations. We serve about 15,000 patients in the Columbia Gorge. For any of you who have ever done any windsurfing, it's kind of known as one of the capitals in the world for windsurfing. So Hood River is known for that. Wasco County, which includes the Dalles, Skamania and Klickitat are in Washington. So we're a border clinic as well, which adds some unique challenges during this time in terms of state licensing when you move to telehealth, for instance. Our mission is really to advance health and social justice for all members of our community. So we serve about half of our population speaks Spanish as their primary language. More than half of our patients are on Medicaid. Under 200% FPL is the majority of our patients as well. We started in 1986. We started as just a migrant health center, not even a federally qualified health center, and then became a federally qualified health center over time. We're a little under 200 staff. We do medical, dental, behavioral health, which includes a lot of different mental health services. And then preventative health is a big part of what we do. So we have a perinatal program. So we help expecting mothers and new mothers through the journey of pregnancy and beyond. And we also deliver babies. So we have physicians, a partnership with Providence, and our physicians deliver at Providence in Hood River. And then we, like I mentioned, a lot of focus on at-risk populations. So we dedicate a lot of our preventative health services to education, engagement in health, and it's a big area of growth for us. We are rapidly kind of expanding in this area. We also are looking at a lot of digital tools to help with that process. When I started here, I thought, telehealth and some of the areas we're looking at would take quite a while to get adopted, particularly because the clinic had, traditionally had not innovated very quickly, but we were able to get telehealth up and running in about 2 weeks. In a 3-week period, we went from 0 virtual visits to 70% of all of our visits were virtual. 100% of our behavioral health visits were virtual. And we've quickly recovered our engagements with patients, surprisingly, because of that. So as you can imagine, serving this population, folks may not have ever done a Zoom meeting before, right? Folks, they don't necessarily have some of the tools that, you all probably, we all take for granted. So the idea of how do we engage folks not only in their healthcare, but in teaching them about technology, helping them learn how to, remove apps from their phone so they can free up space to add my chart. The level of engagement is totally different for our organization now. We have to essentially, be somewhat of a tech support group in addition to a healthcare organization. And so it's really brought in some unique challenges. We've also had to learn how to use PPE, personal protective equipment. Our folks were never comfortable, had never been exposed to that before. And that also changes the dynamic on the ground when you're, wearing a face shield and an N95 mask, and you're outside seeing people, and it creates a totally different environment. There's a huge human element to what we're doing, both on the side of how people react when they see you in that gear. It creates a bit of a fear, as you can imagine. We're not in the full PAPR hazmat suits, but it's kind of along those lines, right? So that's an interesting dynamic on the ground on kind of a day-to-day basis. But then also for our staff, right? Staff who may have children, young children at home, or maybe caregivers for their parents. And when they're out there potentially seeing COVID positive patients, and they're bringing that home after work, right? They're worried they're bringing it back into their to their family. So it's been a tremendous challenge for us, but our teams have been resilient. You know, and it's been economically a very challenging. I don't know if you guys know this, but if you just run a COVID test, the reimbursement's about $16. And if you can imagine the costs associated with that, it's pretty tremendous from both the human side, the human capital side, but also the PPE, the supplies, all of that. So there's quite a few challenges, and we're about to enter what is the migrant seasonal farm worker season, where thousands of folks come up from California and Arizona to work in the harvest. So Hood River and the Dalles are known for their cherries, for their pears, for their apples. And so over the next several months, we'll have thousands of migrant workers coming in who want to work, and they don't want to be told they can't work, and they don't want to necessarily take a test, because if they take a test, they might turn out positive. If they turn out positive, that means their livelihood is taken from them. So it's an interesting dynamic and challenge on the ground, kind of from a, you know, so as you're thinking about solutions, I'm hoping this is helpful to plant some seeds for you of, like, you know, when you're thinking about how does technology play a role in that. And I'm really eager to hear the questions, but just wanted to give you a little few, you know, what it's like on a kind of a day-to-day basis, if this is hopefully useful for you.